Hello, I'm Dr. Russ Schroder, and today we're going to talk about acne and treating it with the Zirconia DermaLaser. So who am I? I'm the best-selling author of Ouch My Head, Kids and Concussions, as well as The Mind Method. I am board certified in chiropractic neurology. I am a fellow in the American College of Functional Neurology, and I'm also licensed and certified through the Pastoral Medical Association. Now, if you were like us, my wife and I, when we were teens, you know that acne is a daily struggle. Waking up to find a new outbreak, a new zit, a new blemish, and then trying to treat it at the time with the latest that was out there, from the Clearasil to Noxzema to even the peroxides and things like that. Now, the statistics are is that 85% of 12 to 25-year-olds will be affected in their lifetime, with billions being spent in the US alone each year. They use celebrity endorsers, Katy Perry and the guy from Maroon 5 and The Voice, on a regular basis to sell us these creams that typically we have to take for years and years and years to maintain the results. Now, Stephen Feldman, a medical doctor and researcher at Wake Forest University, said this, that acne has a significant impact on their self-esteem and quality of life, often leading to anxiety, depression, and even suicidal thoughts. If you were like me and you dealt with this on a daily basis throughout the sophomore, junior, and senior year, going along with braces, it's just traumatic. Some of the worst things that can happen to you are when other teens call you pizza face, when you start getting the scarring and the pock marks that really don't go away on their own and require some of the treatment we're going to talk about later. Now, continuing what he said, there's no single disease which causes more psychic trauma, more maladjustment between parents and children, more general insecurity and feelings of inferiority and greater sums of psychic suffering than does acne vulgaris. And we know this is true. If you have kids that are suffering with this, if you suffered with it yourself when you were younger, you understand the daily psychic trauma that goes on with feeling inferior, feeling like less than the other kids, being bullied about it, being called pizza face. Now, if you are tired of the pills and creams and you're looking for a safe and natural alternative to this, let's look at what the National Library of Medicine's research has to say about low-level lasers and acne. First off, Jeffrey Busford at the Mayo Clinic says that laser therapy is really a form of light therapy. And lasers are important in that they are convenient sources of intense light at a wavelength that stimulates specific physiological functions, which are the cytochromes, which are the enzymes in the cell walls. Okay? These are actually part of the electron transport chain that pass electrons along one to the next. These enzymes that are in the cell wall pass along the electrons and have this physiological process, which is to stimulate the cell. Okay? Now, these are required by the body to perform all of its activities, such as raising a finger in order for a muscle to move, to think a thought if a neuron fires, or healing a wound. More on that later. So real-life translation, low-level lasers stimulate the metabolism of cells, causing them to heal or to operate at a faster rate. It helps the body regenerate cells, reduce inflammation, and promotes an increase in blood supply. Yet for the acne germ, the laser heats the cell and damages it. Okay? At the tissue level, Stanford found that low-level cold laser treatment even results in increased collagen production. Now that's important because when we start getting the scarring, when we start getting the buildup of the scar tissue, the pock marks, the collagen is what helps that to fill that in and to heal that. Now, in 2007, a study looking at lasers treated just one side of the face with the DermaLaser, and they found that there was a significant improvement in the lesion, in the outbreaks, and as this slide says, when they just treated the one side, in just 8 weeks there was a dramatic difference. So the side of the face that was affected, that was treated, was affected, improved dramatically. In 2008, the Journal of Cosmetic Dermatology actually graded it looking at how bad the acne was, the total lesion or zit count. And there was significant improvement in the quality of life, besides the actual damage done from the scarring and the acne. That by using the DermaLaser, there was improved quality of life, because that's important in our self-esteem. That's part of the measurement that they use. Now, preliminary research back in 2000, before it was FDA cleared in 2004-2005, the British Journal of Dermatology used the blue-red combination laser, found the antibacterial effect and the anti-inflammatory action, meaning that the treatment of acne from mild to moderate severity had great long-term effect with no side effects. A study in the Journal of Drugs and Dermatology found that after just a 4-week period, the average reduction was about 70%, just 4 to 8 weeks later. They said that that pattern is similar to those in other studies, meaning that in just after a month to 2 months, that there's a 70% improvement in the acne outcome. In a paper called Laser Treatment of Facial Scars, the combination of the red and blue beam actually found that it helped to stimulate the production of the collagen to fill in the damage that was done from the previous scar tissue that many of us had before the lasers came along. So how does this compare the ingredients in the creams? A 2009 study in the British Journal of Dermatology found that actually it was an improvement that was more effective than topical 5% benzoyl peroxide cream, which is the standard that's out there right now. A 2000 study said that about laser therapy, that more and more clinical trials are seeing how effective it is at treating moderate to severe inflammatory acne. Okay? And this was right after a 2006 study found that there was excellent improvement in the potential to treat mild to severe acne. So to receive our free DermaLaser report that we've written, all you have to do is call 740-588-3339, leave your name and mailing address and the condition you're calling about, which of course is acne. So call our office, leave your name and mailing address, and leave the code word, the condition acne vulgaris or acne. Thank you very much.